Jude from @JudeRebornGirl. I can also be found at @JudeRebornGirl.com. If you're new here, please know that I'm a girl at 70 that is making videos and is a content creator about the subject of facelift. And that's because in 2023, I had 5 facial plastic surgery procedures, and they changed my life. I had a deep flame facelift, a neck lift, a lip lift. I had a partial restoration of an upper bleph, and I had a temporal brow lift. And I couldn't be happier. I'm so proud of the way I look. But further than that, I'm so excited to be sharing kind of the gospel of facelift and helping women to change their lives. At 70, I just feel terrific. I feel like I'm 40 again, and people mistake me for being in my 40s. So it's a huge blessing. And I'm trying to pay it back and sort of pay it forward, helping other women learn about facelift and feel confident that they understand all the nuances of facelift. Today, we're going to talk about a subject that seems to have a lot of confusion and mystery surrounding it, autologous fat grafting, which is the procedure where fat is removed from one part of your body and it's reinserted into another part of your body. Today, we're going to talk about facial fat grafting and how it's utilized in facial rejuvenation, i.e. with facelifts, neck lifts, brow lifts, lip lifts, and also quite frequently with blephoraplasty. Now today we're not going to talk as much about blephoraplasty. I'll be doing a separate video on fat grafting and blephoraplasty. We are going to talk about fat grafting and everything that a consumer needs to know when you're being asked by your doctor, do you want to have fat grafting as part of your facelift? The subject of fat grafting really caught my eye, and I decided to make a video about it because I was sort of scrolling through the chats on Facebook, and I noticed many women talking about the way that their fat grafting had settled over time. And I noticed discussion about bumps and lumps and all kinds of calcification issues. I also noticed some people saying that they hadn't seen a change and that they felt that they had spent their money unwisely. So it really caught my attention, and I thought, this is an issue where we consumers need to be more informed before we consent or actually ask or request for fat grafting to be made available. So I'm going to tell you everything that I found, and you can make your own decision. One thing that is very true is that you want to make sure that you go with a plastic surgeon that is a specialist in fat grafting. Don't go with a newbie. Make sure you ask the surgeon how long and how often they perform fat grafting procedures. And this is why that's so important. For the plastic surgeon who thinks that this is going to be a relatively quick and simple process, a surgeon that perhaps doesn't do this that often, it's going to result in a lot of frustration and poor outcomes. There's a lot involved. They have to prepare the equipment. They have to prepare for the harvesting by conversing with you about what part of the body you want the fat to be harvested from. They have to determine how much fat they're going to harvest and their harvesting technique, their injection technique. They also oftentimes want to over-inject to compensate, to make sure that you have enough fat that's accepted by your body. So they have to determine the right amount if they're going to overfill. And all of these have to be considered, not to mention the delicate sort of balance between the artistic and the scientific technique that is involved to get it just right so that it's very smooth, it's very natural, and that you don't have side effects. Plastic surgeons that embrace fat transfer surgery as a means of enhancing volume in the hollows of the face look at it as a vehicle for restoring symmetry and contours to the topography of the face, because unlike fillers, they are working with the patient's own organic fat, using fat from the patient's body versus a dermal filler, which is a non-organic substance, reduces the risk of allergic reactions. Now, let's take a look at how fat transfer provides a solution to facial aging. When you are in your early 40s, you may begin to notice signs of volume loss. This is the erosion of fat pads due to aging. You may start to hollow out around your eyes or temples, causing you to appear a bit tired. And as you move through your 40s, gravity and perimenopause begin to affect the laxity of the skin, causing the skin to lengthen. As you move into your 50s, the skin loosens more and the face shape lengthens even more. Over time, the face shape morphs from a youthful heart shape to more of a square shape. The face shape evolution reflects a gradual increase in fat loss or volume, and simultaneous increase in laxity or loosening and relaxing of the tissues. The solution for those displaying volume loss and laxity with flaccid skin is a deep plane facelift, oftentimes augmented by strategic placement of autologous fat, which is fat taken from your own body. This combination can restore the face to a lovely, youthful heart shape and restore vitality to areas such as eyes, temples, lips, chin, and upper cheeks, which were lean and hollow prior due to volume loss. Autologous fat grafting can also revitalize the skin by improving tone and texture. And the beautiful thing is that fat transfer is a minimally invasive technique that does not require large incisions. There's very little chance it will leave noticeable scarring. Finally, fat tends to last longer than fillers like Restylane and Juvederm. So here's the question. If fat grafting has so many great applications, why don't all plastic surgeons choose to offer it with facelift surgery? And why aren't all of the patients who experience fat transfer surgery delighted with their results? Well, to answer the question, we will need to dive into the intricacies of fat grafting, also known as fat transfer. The truth is, fat grafting comes with a number of challenges that cause some plastic surgeons to shy away from fat grafting or to limit its use. Let's explore those challenges. The biggest challenge is that the body doesn't absorb all of the injected fat. In fact, statistics indicate that only 30 to 50% of the fat injected into the body is absorbed by the body. It's sort of like when you sod your backyard and you find that a portion of the sod never took and doesn't go on to grow in certain areas. So seasoned doctors will overfill the target areas to compensate for these absorption issues. In the hands of a seasoned plastic surgeon who knows how to correctly gauge for absorption issues, you should be left with your desired result. But this issue, which is a big challenge, is known as inconsistent fat survival. The fat survival concern makes the results unreliable in the eyes of many plastic surgeons. This lack of reliability can be off-putting to them, and the answer to a fat transfer that produces lackluster results is that the patient has to undergo another surgery. Not great. Now, there are certain conditions that negatively impact the survival of the injected fat that you should be aware of. These include cases of planned weight loss or ongoing weight gain. So what are the downsides to fat grafting that we consumers must be aware of? Well, the most common are bruising and edema, or as we call it, swelling. Also, a feeling of numbness or loss of sensation in the fat-filled areas. Now keep in mind, the loss of sensation is typically temporary. Also, the issue of overcorrection due to the transfer of excess fat, resulting in patients who feel that their cheeks look fat, their lips look duck-like or pillow-like, and their jawline may appear to be asymmetrical. These are common concerns. And also undercorrection due to the transfer of an insufficient volume of fat. This leaves patients complaining that they just don't see any difference in their under eye hollows, or that their hollow temples still appear concave post-surgery. Then there is the chance of developing pyogenic granulomas. These are benign, non-cancerous lesions that appear on the skin that break and bleed easily, leaving the patch of skin that was grafted looking irritated with red bumps. There is also the risk of developing cellulitis, a potentially dangerous bacterial skin infection that leaves the skin looking swollen and red and may feel hot to the touch. Cellulitis is treated with antibiotics. Other complications include a chance of blistering, scarring, tissue bunching, palpable deformities such as lumps from injections that are placed too superficially, contour irregularities, nodules, calcifications, pain at the donor site due to inadequate anesthesia, or deformity at the donor site due to excessive or unequal fat harvesting, blindness or stroke due to occlusion of the internal carotid artery, even, and while it is rare, fat embolism. But don't get me wrong, I want to set the record straight. More than 500,000 facial fat grafting procedures are performed worldwide every year, and the trend is rapidly increasing with a high satisfaction rate for both patient, which is at 91.1%, and surgeon, which is at 88.6%. So, the question is, are facial fat transfers worth it? Well, fat transfer to the face typically has a higher survival rate, especially in areas that don't move. The aging process does continue after the procedure, but patients enjoy a more youthful appearance for many years. The plastic surgeons say that they like to use fat grafting in various areas to minimize signs of aging, and many, if not most, prefer them to dermal filler. I have an excellent surgeon, Dr. Jean-Paul Uzzi. He practices in South Florida, in Jupiter and Palm City, and he is terrific. I mean, I'm 70 and look at how much younger I look. He really did a great job without general anesthesia, I might add. So I asked him, what is your position? I remember that he did not offer fat grafting as part of my facelift. He said, you don't really need it with a deep plane facelift, because with a deep plane facelift, I pull everything up. And once it's back to where it used to be when you were younger, you have the cushioning, you have the structure and the buoyancy to hold everything up and to give you the volume that you're seeking. You get that volume back naturally when you lift everything and it goes back to where it used to be. And that made sense to me. You have the anatomy structurally that held your face in a certain way when you were 20 years younger, and it's still there. And with the deep plane facelift, they lift it back up and sort of put it back into that position. It's essential to know that the effects of facial fat transfer are not entirely permanent. While the transferred fat cells can survive and remain in the body for many years, they will break down eventually and be absorbed back by the body over time. This process can take anywhere from several months to several years, depending upon various factors such as your age, the location of the fat transfer, and the quality of the transferred fat. Even though the effects of facial fat transfer are only semi-permanent, they still do last for a long time. Many patients report that their facial fat transfer results last several years, and some even say that they have maintained their results for over 5 years. Thank you for watching today. I'm so grateful. I appreciate the time that you spend with me, and I have many other videos. I think at this point I have 27 other videos that you can go ahead and watch. And if you're just starting out and you want to understand the experience of facelift, then this video, My Miracle Facelift Part 1, and I also made a Part 2. These two videos collectively, right at this moment in time, have just under 20,000 views. So they're very popular, and you might want to start out and look at these. And don't hesitate to visit my website at judereborngirl.com, where you can find my videos, my blogs. You can sign up for my newsletter. In the fall, I will be having live events for everyone that's signed up for the newsletter, and I'll be interviewing plastic surgeons and other people that will bring you valuable information about image enhancement. You can do all of that on my website, and it's sort of a one-stop destination. So be sure to visit, subscribe, and if you should like this video, please like it and share it. And again, we really appreciate your viewership. Thank you, take care, and I will see you on the next video. Ciao.